Thanks so much for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We do begin this morning with Jay Tinkler. He's the State of Utah Assistant Special Agent in Charge for the DEA, here to discuss the rise of fentanyl abuse in our community. Jay, so glad to have you on the show. Thanks for being here.
Thank you. Thanks for the invite.
A very important topic to dive into here this morning. Paint the picture for us. Tell us about the problem. What are you seeing here in the state of Utah?
So really what we're seeing now in the last 2 years is just a huge rise in the number of counterfeit prescription look-alike pills that contain fentanyl. And those have been attributed to a vast majority of the overdoses, fatal overdoses as well here in Utah.
When you talk about the impact it's having on our community, first let's start off with who's driving it, who's behind it, and why? Why is this happening?
So you look back a little bit of history, initially China was the country responsible because they were actually, manufacturing these counterfeit pills and shipping these things into the U.S. That changed, there was some legislation that took place and, they shut that down, but they did not shut the introduction and shipment of the precursor chemicals into Mexico. And so Mexico, the drug trafficking organizations are the ones that are producing 99.9% of what we see here in Utah and the vast majority of that you see throughout the country.
And why have we seen this trend with lacing these drugs with fentanyl? Like, what's the purpose and reason behind that?
So as you look at fentanyl, compared to heroin, it's a much more strong opiate. It's about 50 to 100 times more, lethal, 50 to 100 times more stronger than morphine itself. And so as you start to see, it's just a marketing for them. People, the word gets out on the street that, there's a new product out. There's something that really is more potent, has a much more of an impact when somebody uses this. And it just doesn't take long for that to trickle out into the community. And as you see, how fentanyl affects the body is so much more lethal, so much more deadly that, as we see 2 milligrams, that's a potential fatal dose for somebody who's not maybe a regular user or not used to opiates themselves. And so that's really where the real danger lies, is the fact now that not only do we see fentanyl in counterfeit pills, we are starting to see this in methamphetamine, cocaine, and heroin we're seeing across Utah and across the United States. And so that just lends a whole new look to, to the risk involved in using these narcotics.
Yeah. So manufacturers, dealers are intentionally doing this. Those who are using, are they doing so knowing, or in most cases are they unaware of the lacing?
You see both. And I've had conversations with some of our public health official partners, and where they were, do interviews of users, and they'll say, hey, it's worth the risk. That's just where they're at. The flip side of that is what we see, especially in the youth today, are the first-time users, the people who are unaware that they are actually taking fentanyl, and the deadly effect it has, how fast it takes effect of a body. And that's really where we're probably having more damage done to the community.
How addictive is it? Once someone tries a fentanyl-laced drug, are they hooked right off the bat?
I think that's dependent on the person.
Okay.
I think, unfortunately now where we're at right now, almost 50% of those counterfeit pills we see have got a fatal amount of fentanyl in them. And so, unfortunately, for a lot of people, the first time they use is the last time they use.
You mentioned that you're starting to see it mixed in even methamphetamine right now. We've always heard not even once with meth because of the addictive nature of it. What kind of an impact is that combination having? So
that's just amplifying what we see, in the public health system, out on the street. Like I said, a lot of times, people are buying something thinking that it's methamphetamine and it's got fentanyl laced in it. And so we've started to see an uptick in meth-related overdose deaths as well.
You've already mentioned this a little bit, but go deeper, if you will, into the impact that this crisis is having on our community right here in our neighborhoods in the state of Utah.
So, so it comes as no surprise. The last week or so, there's one of the latest arrests in an investigation that our office was a part of. It was somebody that was distributing counterfeit-laced pills to some young folks around. And so, when you look at that, the impact of that in our school system, our children, it's something that we need to talk about. There's a huge influx of pills being seized by our state and local uniformed officers and troopers out on the highway, because Utah sits at a kind of a crossroads of America, and so most of our narcotics, our illegal narcotics that are seized, are coming from California and Arizona. And so that's really, as you look at it now, when you look at this case, that's been in the news, and you look at the problem with that is it's the availability and the use of the internet, how easy it is to obtain these. That's really something that we need to all need to be aware of.
Yeah. It's very troubling to hear you talk about this being in a school setting and with our children. How prevalent is this problem with school-aged children?
It's more prevalent than we would like to admit. As a parent myself, it's one of those things that keeps me up at night. And the problem is, it's just the ease with which you can obtain these. With a cell phone, a smartphone, laptop, order something over the internet, have it shipped to your house, a friend's house, a post office box. And our kids are taking things that, as adolescents, it's just part of growing up, taking risks and things like that. The problem is now they may think that they're taking OxyContin and oxycodone that they purchased over the internet, and unfortunately, it's going to have a lethal amount of fentanyl in it.
Yeah. Jay, you mentioned yourself being a parent. What do parents need to know? What do they need to be watching out for within their own children for potential signs that they could be caught up in this?
I would say look for any changes in behavior. Be involved in your children. Monitor what they're looking at on the internet. It's never too early to start talking to your children. Elementary age is not too early to start talking to your children about the risks of. Never take something that doesn't come from your parents, your doctors, from a pharmacist.
Are you seeing cases at the elementary level?
We haven't, but we have seen fatalities in the junior high population.
Okay. So obviously, the earlier you can start, the more foundation you can begin to build.
Absolutely.
As an organization, the Drug Enforcement Agency, what are the solutions moving forward? What are you doing to try to get ahead of this situation?
From our perspective, it's one of the big things is the public awareness campaign. The One Pill Can Kill DEA, published that this past year, and so it's really about public awareness, working together with law enforcement or public health officials to let people know what the dangers are out there, because unfortunately some people are going to take things regardless of what you say, but at the end of the day, I think if we increase awareness of that in this campaign, and of course we have redoubled our law enforcement efforts trying to slow this stuff down.
You mentioned a case from earlier in the week that y'all were talking about, and we've seen others just like it, where dealers have been arrested and facing charges for providing these fentanyl-laced drugs in our community. Talk about the seriousness of those charges and what dealers can be facing if they are convicted in a case like this.
Sure. So we've been very fortunate here in the state of Utah. The United States Attorney's Office have dedicated prosecutors to cases, and we look at these investigations. They're overdose, especially with the death as a result of, and so you're looking at a potential. This instance, this individual is looking at a potential sentence of 20 years in federal prison, and so if it's a case of a juvenile or child or something else, that even enhances that, and so. We get great cooperation from our partners at the U.S. Attorney's Office prosecuting these cases, and so regardless if it's of the amount of fentanyl that we seize, we've been very successful in our efforts to put these people away for a while.
Do you feel overwhelmed in your work when it comes to this issue, or is there hope that we can begin to make a dent in it?
There are days, there are in the law enforcement field. I don't think anybody doesn't feel overwhelmed from time to time, but I think you have to keep pushing forward, working together, fighting the good fight, because, what we're doing here is trying to protect our children at the end of the day.
Yeah, and we all know we've been dealing with this opioid crisis for years and years, and now this just adds a whole new level to it.
It does, unfortunately.
Yeah. Jay Tinkler, very important information. We really appreciate it. Thanks so much for being here with us.
Thank you for having me.
You bet.